Welcome back. Well, making sure we have no surprises when it comes to your heart. So in honor of Heart Health Awareness Month, this morning, we're talking about a non-invasive procedure that really measures the amount of calcium buildup in the coronary arteries. In short, it can really tell you if you have a higher chance of blockage and or a heart attack. So this is something I did not know about. So obviously we have got Dr. Diana Brittner telling us a little bit more about this. So tell us a little bit about this test, because I was reading up on it beforehand, and this is something I had no idea about.
Well, I'm pretty fired up about this right now. Like, it's just, I've had so many patients recently who you'd look at them and never think, oh, they're at risk for heart disease, and their score is positive. So again, I'm just really fired up, and it just makes me crazy that insurance does not cover this. But what the score measures is calcified plaque. So it means that there's been some plaque in your artery wall for a little bit, and now your body starts to calcify it. It forms a immune reaction around this fatty plaque, and then the cells try to wall it off. It's like putting a cap on a volcano. And, you know, on one hand, it's kind of good because it keeps it from erupting. A plaque is almost like a pimple. It's kind of gross. But if it erupts, it causes a blockage in the vein, or in the artery, rather.
And I think that's such a good point that you were just saying, because I think so many times in our lives, you know, I have had people in my own life where it's like, oh my gosh, they run every day, they're at the gym, they eat healthy. How did they have a heart attack? And this could be kind of that reason. It could be that calcium buildup.
Right, and that happens because that person who runs and eats well and is thin, you know, their liver probably makes these particles that are like bringing gas to a fire. So that lipo(a) or that ApoB, those are things that genetically some people make, and they form this plaque.
So tell us a little bit about the test and what may be a trigger that someone may be like, okay, I want to go talk to my doctor, see if I can get this test.
The test is easy, it's non-invasive, it takes 10 minutes. A couple places around town are able to do this. You walk in, it's a CAT scan of the heart, there's no IV, there's no dye. People who qualify would be someone who is overweight, has family history, has a cholesterol that's high, but we don't know, is it high enough to treat? Are their blood sugars high? Did they have diabetes? Did they have preeclampsia when they were pregnant?
So tell us, obviously every week you have an example of what this is needed. So tell us a little bit about Jane here.
So Jane's 51, she's thin, she's a runner, but her mom had a heart attack at 55, which is a red flag, and then her brother had a heart attack at 52. And so for her, she was just starting to go into menopause. We know risk factors go up. And I said, let's get that CAC. Her LDL was 120, and some people are like, that's pretty good. You know, do we take a statin, do we not? And so we did that CAC to help her make a decision. The CAC was positive, it was 200. So we know that 0 is the best, of course. 0 to 100, it's starting to happen, let's get on it, let's figure out why. From 100 to 400, we gotta get crack-a-lackin'. We gotta get moving on this because they're starting to build up more plaque in the walls. And then over 400, you need a stress test. So Jane was 200, and it was time to get on it. So we did particle sizes. Her lipo(a) was high, it was 100. And so definitely a statin, and then to follow her over time and maybe even more. So anyways, it was just such a gift because we avoided the surprise.
So this is a huge indicator and can really point you in the right direction of what maybe next steps need to be from this. You said like 10-minute test?
10-minute test. And locally, again, insurance doesn't pay for it for screening, which is absolutely crazy. There's good data, it makes good decisions, but it's about $250. So again, I just wish the takeaway is everyone asks their provider, do I qualify for a CAC, and push.
And in the grand scheme of things, $250 might be
life-saving.
All right, we always appreciate all of your tips, and we'll get more information about that on our website as well. But thanks for again, and happy Valentine's Day. Speaking of our hearts,
go Red.
Go Red. That's right.
Thank you.